Hey, I'm Tanya. I'm going to be your nurse practitioner for today. How are you doing?
Good.
Okay. So, what I'm going to be doing to you today is I'm going to just be listening to you, to your lungs, and to your heart, and I will be touching you if that's okay. Let me give you a little bit. Are you fairly comfortable? Are you warm enough? Okay, good. So, my first thing to look at is the inspection. I want to see if everything is symmetrical. I'm looking at her rate of breathing. I'm looking if she's using any accessory muscles, any nasal flaring, anything like that. Everything seems to be okay. After inspection, the next thing I'm going to be doing is I'll be palpating you. I'm looking for any air trapping, any masses, any tenderness, anything that is not normal. Okay. Okay, good. I will be percussing, which means I will be using my hands and I'm going to be tapping up against your chest. I'm listening for different sounds. The lung sound should be resonant. If it is hyperresonant, that suggests any air trapping. If it is dull, either I'm hitting the rib or there's some infusion going on. And while I'm doing this too, I'm looking for diaphragmatic excursion, which means it will let me know how far your lungs are opening up and if everything is good. So I'm looking for, until I hit the dullness sound, I'm gonna do it on both sides. Okay, right around there. Now I want you to breathe out and then breathe in. Okay. Do it one more time. Okay. Breathe in. It should be up here. Okay. So it was right around this part. About, I would say about 2 centimeters in her case, which is the difference of her lung movement, her lung expansion. So I will be auscultating you, which means I'm going to be listening to your lung sounds. Normal lung sounds, or most lung sounds, should be vestibular, which are soft, low-pitched, rapid sounds, especially on inspiration. However, over the trachea, it's a little bit harsher sounding, and bronchiovestibular sounds are louder as well, but mainly it should sound soft. So go ahead and deep breathe in. Okay, good. Everything sounds good. I don't hear any adventitious sounds, no bronchi, no wheezing, no anything abnormal. So we did the front. I would like to do the same to the back side. So if you can kind of move around, yep, just like that. So we're going to do the same to the posterior. We're going to look and see if everything is symmetrical, if there are any bruising, any lumps, anything going on. And then of course I will palpate again. Let me know if there's any tenderness, if it hurts. Okay, good. We're going to do the tactile fremitus again. Once I place my palms up against you, just say 99.
99, 99, 99, 99, 99.
Okay, and then I will be percussing back here as well. Want to make sure I don't hit the clavicular on here. Until I heal this dullness, which, okay, right around here. Same thing again. I want you to take a deep breath out, all the way out, and then take a deep breath in. Hold it. Okay, again, breathe out. I think it was just about the same. And we can also do it this way. Breathe in, really deep. Okay. And out. Okay. Breathe in. Right up here. Perfect. So again, it's another 2.5 centimeters, which is perfectly normal. I will be listening to you again in the back. We have different spots to listen at right here, right in the mid-clavicular area. The breath sounds are a little bit harsher because there's the trachea bronchi right there. So take a deep breath in. Deep breath in and out. Deep in and out. I know, it takes a lot. One more time. Again, I do not hear any bronchi, wheezing, or any adventitious sounds. If there would be concerns for any abnormal sounds, I would test further, and for this purpose of this video, I'm gonna do it too. So first we're gonna listen for bronchophony, which means she's gonna be saying 99, or you're gonna be saying 99, and I will be listening. If for some reason I hear it louder anywhere, that means there's air trapping. Okay, so let me get my stethoscope together. So every time I touch you, I'd like for you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Everything sounds good. There is not really any louder sound anywhere. It's symmetrical throughout. We're gonna do another thing. It's called Egophony. So instead of saying 99, I would like for you to say E every time I touch you. And should I hear the E sound going from an E to an A, that would mean there's some consolidation anywhere. So, all right.
E, 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 E.
Okay. Everything sounds good. As I said, it would be, instead of E, it would sound kind of like a muffled, like A kind of sound. We're gonna do one more test. It's called whispered pectoriloquy. So that means she is gonna whisper 1, 2, 3. I'm gonna be listening again. If I hear the whisper louder, that will also mean there's some consolidation in there, which could suggest pneumonia. All right, let's do this. So instead of saying 1, 2, 3, I want you to whisper it, okay? Whisper it. Are you saying it? Okay. So this is actually a normal finding. I shouldn't be hearing much at all. If for some reason, as I said, if I hear it loud, that is consolidation, and that's not what we want. So that concludes the thorax exam. I want you to come over my way a little bit. So we're gonna do your heart next. The first I'm gonna be doing is looking at your jugular venous pressure. So if you could lay down for me. Okay. So the jugular venous pressure is right over the sternocleidomastoid muscle. Turn your head my way. I'm just gonna look. And you can see the pulsation. But for this, it's easier for me to have you look to your left, because I'm gonna be doing this one. So in order to find the jugular venous pressure, I'm gonna use my ruler, and I'm gonna find the meniscus. It is the point of the highest oscillation of the jugular venous pulsation. So I can see it right here, which means I'm gonna be taking my cards right here on this. Hold it pretty steady, and then I'm gonna measure with the ruler. Put it okay, and we're gonna round it off to the next. So in her case, it is about 2. The norm is between 3 and 4, which she's still younger. It might be just her norm. I'm sure there's nothing going on. If it would be below her her stenopraxis, that could indicate any dehydration. If it would be, above, it could go all the way up to the chin. That could mean, some fluid overload or something like that. But in her case, it seems to be within range. I am gonna palpate, and I don't want to do both of these pressures at the same time. So turn your head toward me again. And again, I'm just feeling right in here. and I'm looking for the upstroke. It should be rapid and fast, but it shouldn't be pounding. Okay, and turn your head the other way. I'm looking again if both sides are about the same. Just the amplitude is about the same. With this one, also what we're going to do is we're going to listen with the bell and listen for any bruits if we hear them. And I shouldn't hear any, but you use the bell, listen over. And again, too, if I press hard, it might be harder to hear it. If I just hold the bell easy, I should be easy. I should be hearing a bruit if there was one. But again, in your case, I doubt it. Okay, turn your head my way. I'm going to listen with my diaphragm. Okay, turn the other way. Okay, good. As I said, it should about be the same on both sides. It's not pounding or anything. Before I listen to all of your heart sounds, I do want to check out your point of maximal impulse, which is right above or right around the apical portion on the mid-clavicular, your left side, right around the fifth intercostal space. And that is where, I'm going to just lift this up a little bit, the maximum impulse is. That is where the left ventricle kind of touches the and the easiest way to is, if it's hard to feel right here, you can lay for me to your left side, yeah, like that. And then I guess have your underarm up toward your head. There you go. And the point of maximum impulse, it should be just about a quarter size. And it's right, as I said, right in the apical area, right around the fifth intercostal space. And her area seems to be a little bit smaller. But again, I think it's kind of expected in her age. Okay, come on over. You can lay back. I'm going to be listening to you. So we're going to listen to her heart sounds. And it goes apical, pulmonic, Erb's point, tricuspid, and apical. And again, we're listening to anything abnormal. I should be hearing S1 and S2 sounds. However, I will be listening on the mitral area also. In her case, since she is so young, I might hear S3 sound. And that is perfectly normal in younger kids. So let me listen. I should not hear any murmurs, however, any abnormal sounds. am going to listen with the bell. And again, it's easier for me to hear if you lay to your left side one more time and have your arm up above your head a little bit. Or to, yeah, out of the way. All right, well, everything sounds good. You can sit up if you want to. I didn't hear anything abnormal, no abnormal lung sounds, no abnormal heart sounds, no murmurs. So the only other thing that we want to do is, since we're checking the heart, let me just see your hands, because you know, sometimes even though your nails are colored, if your heart is not functioning well, you will get a little bit cyanosis where your hands might be just numbish and blue and just not right. But everything looks good here. So thank you so much. All right, that concludes our video. Thank you.